Hi there. Today we'll be talking about Adderall. Its chemical makeup is amphetamine aspartate monohydrate, amphetamine sulfate, dextroamphetamine saccharate, and dextroamphetamine sulfate. And I'll be talking today about the history, the effects, and things to consider when looking at Adderall. The history of Adderall was first developed in 1934, not under its current brand name, but same chemical makeup. And it was initially used to help with cold symptoms, but pretty quickly it became known for cognitive enhancement and was just sold over the counter, so to speak, until 1939 when it became available by prescription only. It was kind of looked on as an energy pill and was widely used by the British and U.S. troops during World War II. In the 50s, it was considered Mother's Little Helper was its nickname, giving women more energy to handle issues at home as well as children, etc. The addictive potential was largely ignored. Now it comes with the following warning: high potential for abuse. Prolonged use may lead to drug dependence and must be avoided. Misuse of amphetamine may cause sudden death and serious cardiovascular adverse effects. Pharmacological aspects of Adderall: the dosage for adults, it's used to treat ADHD and narcolepsy. The dosage for adults for narcolepsy is 10 milligrams a day, increasing 10 milligrams at weekly intervals until the desired effect is achieved. Usual dosage is 5 up to 60 milligrams a day. That's pretty high compared to the ADHD dosage. That is the same for adults and pediatric dosage, which starts at 2.5 milligrams a day for children ages 3 to 5 years old, and then goes to 5 to 10 milligrams a day starting dose for ages 6 years and up, including adults. And you would increase the dosage either at 2.5 or 5 milligrams at weekly intervals, again until the desired effect is achieved, but not to exceed 40 milligrams a day for the treatment of ADHD. The frequency is daily, first dose administered upon waking up in the morning. Additional doses, perhaps 1 or 2, at intervals of every 4 to 6 hours. And you want to make sure that a client would avoid taking it in the evening because it would disrupt their sleep, potentially giving them insomnia. The method of administration is oral, although this is an abused substance as well. And so for people who are abusing the substance at a pretty high level, it's sometimes ground into a powder and inhaled because it gets through to the bloodstream faster that way. Interaction with other drugs: there's 2 main drugs that you want to be careful about. The first is gastrointestinal alkalinizing agents, basically antacids. They can increase the blood levels of Adderall in the body and would increase its effects much further than what one would expect with the dosage. It should also not be used if MAOIs have been given within 2 weeks because MAOIs slow the metabolism of Adderall in the body, and it can build up and a hypertensive crisis can result. As I mentioned, Adderall is a substance that is abused currently in our society. It's kind of got an extracurricular usage, if you will pardon the pun, in that it is used by a lot of college students today to increase their motivation to study and to increase their levels of concentration. It's estimated that upwards of 25% of college students have used or currently are using Adderall as a study aid. They consider it a study drug or a smart drug. The nickname is Addy, and it's sold throughout campuses for roughly $5 a pill, so pretty inexpensive. Again, the highly addictive nature is kind of overlooked or downplayed by most students. They see it as kind of a safe way of improving their academic achievements. The physiological aspects of Adderall: the absorption peaks at 3 hours. That's with a fasting patient, so no food in the stomach. Distribution is throughout the body, and it is found in breast milk. Adderall is metabolized as CYP2D6 in oxidation, and 4-hydroxyamphetamine and norepinephrine as active metabolites. It's excreted in the urine. 30 to 40% of it is unchanged, 50% as alpha-hydroxyamphetamine derivatives. The body's reactions are increased focus and motivation. Those are kind of the two more positive aspects of Adderall in the body, but it also can lead to increased heart rate, nervousness, restlessness, headache, problems getting to sleep or staying asleep, feeling dizzy, dry mouth, hoarseness, or slowed speech. Changes in your vision are also possible, and it can lead to a large number of stomach upset issues, including nausea, vomiting, diarrhea, stomach pain, and constipation. So it's important to, again, make sure a client wasn't tempted then, because of those stomach issues, to take antacids, because that would, as explained on a previous page, lead to a lot of difficulties for the client. Loss of appetite and weight loss are also really common responses or reactions to Adderall. Psychological aspects of Adderall, the expectations are increased focus, energy, and enthusiasm for the task at hand. The mood is elevated, but it can occasionally lead to aggressive behavior in both children and adults, so that's something to be aware of. And task impact, you're better able to focus attention and do it for longer periods of time. However, if your task is sleeping, it can be very disruptive in cases of abuse. And these are the references for the research that I did, and I hope you learned some new information about Adderall, its use and abuse. Thanks so much.